VA's Office of Blind Rehabilitation Services estimates there are approximately 130,000 veterans in the United States who are legally blind, and more than 1 million veterans who have low vision that causes a loss of ability to perform necessary daily activities. In this era of instant communication, where we get overwhelmed with data or facts that are useless to unsighted individuals, wouldn't it be great if we could count on news focused on real problems that impact the daily lives of veterans without sight? Introducing Wisdom for Blinded Veterans, an advanced informational portal designed by blind veterans specifically for blind and vision-impaired vets that, like them, are facing challenges every day. Hi, my name is Ben, and I know the frustration. I've struggled in day-to-day tasks for over 20 years since I lost my eyesight. One of my biggest challenges has always been trying to stay up to date with the latest information of my eye disease, local news, and the ever-changing technology. I wanted to be able to have one single site that merged all the data scattered, and that's why we created Wisdom for Blinded Vets. This is a portal that can be accessed via the web, a smartphone app, telephone, email, text messaging, or Amazon's Alexa. It integrates with readers such as JAWS or Apple's VoiceOver and various other tools to give you a seamless experience. This portal will keep us updated on a variety of topics and will share knowledge that can help make our lives easier and more fulfilled. Highlights of the topics covered on the portal include podcasts, events, news, blind rehab and training, information on the BVA and other groups, a list of coordinator and bros list, online groups to interact with fellow vets facing the same challenges, and much more. Give us a try. You will not be disappointed. To learn more about us, visit our website www.w4bv.org. If you're interested in sharing your knowledge, please consider becoming a contributor by logging into our portal and going to the contributor section for more information. Wisdom for Blinded Veterans, transforming blind veterans' lives.
You're listening to W4TB Radio from the Wisdom for the Blind studios in Fort Lauderdale, Florida, where we share some wisdom to help you navigate the seas to stay in calm waters. Please visit us on the web at w4tb.org or drop us an email at feedback@w4tb.org. You can also download the W4TB radio app at the Apple Store or Google Play. Please share the knowledge and tell a friend. Now, back to the show.
Ever wondered about your eyes or how to recognize the different eye conditions? Welcome to InSight to the Eye, the show that explores the fascinating world of vision and reveals the secrets of eye health. Broadcasting from Wisdom for the Blind studios in Fort Lauderdale, Florida, hosted by Benjamin Keeley and co-hosted by Dr. Scott Anagnoste, a renowned retinal specialist of the Retina Group of Florida, with extensive expertise in ocular trauma and emergency eye care. Let's welcome Ben Keeley and Dr. Anagnoste as they take us on an enlightening journey through the extraordinary world of eye health and vision.
Alex, thank you very much. You always make us look great. Thanks for the great entry. Hey, ladies and gentlemen, thank you for joining us for the first episode of InSight to the Eye, where my co-host, Dr. Anagnoste. How are you today, Doctor?
Doing great, thank you.
We're both going to be jumping in and talking about different eye issues, different one each episode. And first, we're going to start off. And Doctor, can you introduce yourself and a little bit about your background, please?
Sure. I'm Dr. Scott Anagnoste. I work with Retina Group of Florida in Southeast Florida. I completed my ophthalmology residency at Manhattan Eye, Ear, and Throat, followed by a fellowship in retinal diseases at Bascom Palmer Eye Institute, part of University of Miami, and have been in practice at Retina Group of Florida since 2000.
All right. And for a full disclosure, you've been my doctor for a while too.
Yes, I have.
So I went to you about our first topic. So I remember back in many years ago that I had a major issue with my eyes and couldn't see, and went to you. And you and I talked, and I had a disease called diabetic retinopathy. Am I saying it right?
Retinopathy, yes.
And so why don't we start with the WHO? So in the WHO, what is that?
So diabetic retinopathy refers to damage done to the retina in the back of the eye from diabetes. Diabetes overall causes widespread effects, primarily because over the years there is damage to the small blood vessels of the body. And that occurs in the kidneys, in the feet, in the blood vessels that supply the nerves more generally, but also in the retina. The retina is the tissue in the back of the eye that operates like the sensor in a camera or the film in a camera and converts the image formed by the eye into nerve impulses that go to your brain. And that retina is supplied with its blood supply by small and blood vessels, which are exactly the type of blood vessels that are affected by diabetes. And so over time, the damage to those blood vessels results in a reduction of the circulation to the retina, and various different conditions can emerge from that, all of which are diabetic retinopathy, because it has many different forms.
In the research that I did, preparing for you and I to do this recording, it seems to be pretty relevant out there. A lot of cases, more than I expected. Is that true?
Yes. It is the number one leading cause of new blindness in patients under the age of 65 in America. After about 20 years of diabetes, about 60% of people with type 2, that is adult onset diabetes, will have some retinopathy. And after 20 years, almost all juvenile diabetics will have some sort of retinopathy. The reason this is so critical is because diabetic retinopathy can be managed, and when caught early enough and managed, the visual loss can be largely prevented or mitigated.
And again, when I was looking into our discussion, I came across something called DME. Is that the same, or is that a different eye disease?
DME is diabetic macular edema, and it is one of the things that happens with diabetic retinopathy and can cause visual loss. So fundamentally, the diabetes decreases the circulation to the back of the eye, and the retina has various responses to that. Sometimes there can be what is called macular ischemia, where there's just not enough circulation to the back of the eye and the retina can't work properly. But usually before that, the lack of circulation causes the retinal cells to send out growth factors. And those growth factors do a couple of things, and there's often overlap between what happens. One is that they cause the existing blood vessels to get a little bit leaky. And that leakage of fluid out of the blood vessels causes the retina to swell. Swelling we call edema. And the part that's relevant is the center part of the retina, which is the macula. So that leakage results in macular edema, or swelling of the macula, which can decrease the vision. And so when that macular edema, because other things can cause it too, is from diabetes, it's diabetic macular edema, or DME.
So when you and I first started seeing each other, I used to see a bunch of little dots, and I think you called them floaters.
Yes.
Is that the leakage?
No, generally that will not cause leakage. The leakage will not be caused by leakage. Leakage, typically the symptoms of it are decreased vision, meaning blurriness. Things can look dimmer than they used to. Colors are less saturated. And overall, the ability to read or see fine details is impaired. Floaters are more commonly associated with another aspect of diabetic retinopathy, which is that those same growth factors that cause the swelling can cause new blood vessels to grow. And that is your body's attempt to improve the circulation to the retina. Unfortunately, these new blood vessels don't grow within the retina, but on the surface. And therefore, as the eye moves, they can break and bleed, and that can often give you the new floater.
And that's so the black dot that I see is actually a blood on the eyelid or on the eye itself.
It's within the eye, and typically floaters are black spots that kind of move around. A black spot that's perfectly stationary can be an area of the retina that's just not working. Less typically a black spot than an area where the vision is just missing, but both can happen.
And you said that there's signs that that you can see, one being starting to lose the eye vision itself. Mm-hmm. What are some of the others that would be relevant that you'd see right away that tells you that you need to do something?
Well, frankly, we would always prefer to see a patient before they're having any noticeable changes, because recapturing or improving the vision once the vision has deteriorated is much less successful than preventing it. And that's, I guess, true of all of diabetes. Just as, when you first become diabetic, there aren't a whole lot of very glaring symptoms that tell you, I'm diabetic, I need to run to the doctor. Usually people feel pretty good, and that's part of the problem, for many years before they're diagnosed with diabetes. In the eye, that's certainly the case. And therefore, it's kind of critical for anybody with diabetes to get checked before they have symptoms. That being said, once they have symptoms, there's still a lot that can be done to improve those symptoms and prevent further loss. And the symptoms you're talking about are typically blurry vision, vision that fluctuates a lot depending on the blood sugar. So that, for example, some people notice that if they eat a meal with particularly high in sugars or carbohydrates, their vision gets blurry. That's not normal. New floaters, certainly an issue, and any distortion in the vision. That is, if straight lines start to look crooked. Diabetic retinopathy can affect one eye earlier than the other, and so sometimes people don't necessarily notice the symptoms because with both eyes open, things look okay. So in general practice for everybody, it's not a bad idea to cover one eye at a time and make sure that each eye independently is doing okay.
So in my case, as you know, my right eye is what I call gone. I think you call it fingers, right?
Finger counting. Yes.
Yeah. So why is my right eye worse than my left eye?
A lot of it typically has to do with when the interventions are started. Because as I said, it is fairly common for one eye to be affected earlier than the other. And so typically people come in when the worse eye starts to give them problems, and therefore the ability to recapture vision in that eye or prevent vision loss in that eye is not as good as in the other eye, where we're starting ahead of time. Part of it also is timing. Thankfully, over the last couple of decades, the tools that we have to treat diabetic retinopathy have improved a lot.
Well, that's great news to hear. And does it always come on? It came on pretty fast for me, or I just was ignoring the symptoms. What would you say?
It is deceptive because a lot like high blood pressure or diabetes in the body in general, it is a very slow moving disease, but it has no symptoms for a long time until it hits a sort of tipping point. And that is to say, the retina is getting enough circulation until it's not. And once it's not, the symptoms come on suddenly and progress rapidly. There are things we can do if we catch it before that tipping point. But even if it's after that tipping point, we can often, especially nowadays, prevent it from getting worse and recover it. But your situation is extremely common. It is that if we were to look at your retina, we would see signs of it, but it's not causing any particular symptoms.
And that's pretty much what happened to me. I was driving and all of a sudden it was like, boom. And it's like, I need to stop driving, and it was instantaneous.
Right. And, it's much like the other things that happen with diabetes, for example, kidney disease. If you check the kidney function, you can see that it's declining, but it's still adequate to meet the person's needs. And then all of a sudden it goes from adequate to inadequate, and it seems like it just appeared. But what really happened is it kind of just tipped over the edge of what you need and what you don't. Similarly, most people with high blood pressure feel fine. In the meantime, the high blood pressure is causing damage to the blood vessels and the heart. And many times they don't even notice it unless it happens to be checked for just routinely, or much more frighteningly until it causes a problem. And that's why screening is so critically important for diabetes. Because if we can catch diabetic retinopathy in its initial stages, it is very possible and even likely to be able to prevent it from causing any significant symptoms.
Oh, great. Well, it's time for us to check into the studio. We've covered the what, and when we come back, we're going to talk about the how and what we do next. So, Doc, stay with us, please. And ladies and gentlemen, we'll be right back. You're listening to Insight to the Eye at the Wisdom for the Blind Studios in Fort Lauderdale, Florida. We'll be right back.
Wisdom for the Blind is dedicated to doing everything we can for the blind and sight impaired. If you'd like to bless us with a donation to keep the website, the podcast, the webinars, and the radio station operating, we can't express how grateful we'd be. You can go to the website at w4tb.org. That's w4tb.org and hit the donation button. Or you can mail it to Wisdom for the Blind Incorporated. Attention donations. 1005 Marine Mile Boulevard, Suite 255, Fort Lauderdale, Florida, 33315. Wisdom for the Blind is a not-for-profit 501c3 organization. Remember, it's tax deductible. We thank you from the bottom of our hearts at Wisdom for the Blind. Are you a big geek? Do you enjoy learning about new technology? Then join us on the fourth Thursday of every month for the Wisdom Geek Club at 7 p.m. Eastern Standard Time. You can also hear a pre-recorded episode on Wisdom Radio every Wednesday night at 7 p.m. Eastern. For more information, hit up w4tb.org and click on the Geek Club button on the main page. And don't forget to share the wisdom with a friend. You're listening to W4TB Radio from the Wisdom for the Blind Studios in Fort Lauderdale, Florida, where we share some wisdom to help you navigate the seas to stay in calm waters. Please visit us on the web at w4tb.org or drop us an email at feedback@w4tb.org. You can also download the W4TB radio app at the Apple Store or Google Play. Please share the knowledge and tell a friend. Now, back to the show.
Well, thanks for sticking with us. This is Ben and Dr. Anagnoste. We're here with the first episode of InSight to the Eye, where we're talking about different types of eye diseases. So before we left, we talked about what the disease was, which was diabetic retinopathy. I keep on messing that word up, but doctor, you'll keep me honest on that one.
Okay.
So we talked about what the disease was. So now let's talk about the how. How do we recognize it? How do we treat it? And what are some of the things that we should do to prevent it from getting to this stage?
So there are a couple of layers to it. The first layer is the diabetes, which unfortunately in and of itself is usually asymptomatic. That is, at first, when you're diabetic, especially type 2, there aren't a whole lot of symptoms. Some of the symptoms may be drinking more than usual and therefore urinating more than usual. Some people report some tiredness, but it creeps up. So it's not the kind of thing where anyone is really likely to wake up and have a symptom that tells them, wow, I'm diabetic. I better go get this treated. So especially for adult onset, it's really usually something that's discovered by your doctor. That is, they do a blood test and find that the sugar in your blood is too high.
So is that I didn't mean to interrupt, I'm sorry.
No.
But that's your internist, and when we're talking about the labs, are we talking like the A1C or the glucose?
Well, now increasingly they're looking at the A1C, but both in conjunction, the glucose and the A1C. Typically, if the glucose, when you go to see your doctor, is perfectly normal, the chances are that your A1C is okay. But if your glucose is a little high, they'll usually check an A1C to let them know, is it just a little high at this moment, or is it running high? And that hemoglobin A1C is an unbelievably important test because it tells us sort of what your sugar has been like for the last 3 months or so. It's a little bit different with juvenile diabetes because kids with diabetes, their sugar goes much higher than adult onset diabetes. So that adults who are untreated can often run with sugars in the 2, 3, maybe even 400s. But a child will spike higher than that. And once the sugar gets that high, they can lose consciousness, go into a diabetic coma, even have a seizure. So often children will have, because the diabetes is more severe, sort of a signal that gets them to the doctor or hospital, and then they find out why it is. But with adults, it sort of creeps up and usually gets worse very gradually over a period of years, so that the symptoms of diabetes are very hard to detect yourself. And that's why it's sort of critical to see a general doctor, an internist, a primary care doctor, something like that on a regular basis. Because among other things, diabetes is one of those things that they can catch with fairly easy blood tests before you even notice it. Once the diabetes is detected, the next step should be to see an eye doctor.
that goes to the exact question that I was going to ask. So in my case, the doctor pointed out that I do have diabetes, had me doing the finger stick every day just to see what it was. But I was being managed by pills at the time. At that point, should I have gone to see a specialist, or should I go to like the Four Eyes eye clinic and get a normal eye checkup? What should I do on my own to be a responsible person?
Well, part of it is also that things have changed a lot in the last 20 years, thankfully. And so there's much more awareness among primary healthcare providers of diabetic retinopathy. And there's much more awareness as well among primary eye care providers, such as whoever would prescribe glasses. It used to be much more common that, number one, the primary medical provider wouldn't necessarily send you to have your eyes checked. And number two, when you had your eyes checked, if your vision was normal or okay, that ended the story. Unfortunately, while the vision is normal or okay, a lot can be happening in the back of the eye. More recently, the technology has improved a lot. There are much better cameras. So often the primary eye care provider, who's not a retina specialist, will still be able to get a good picture of the retina and be able to see, wait, that's abnormal. Let's kick this up a level. But also what has happened is both primary medical care providers and payers, meaning the insurance company and government, has gotten much more aggressive about looking at things in a very useful way, so that if a healthcare claim is submitted that includes diabetes in it, or if you're on medication for diabetes, that will automatically sort of prompt them to say, wait a minute, we have a patient who's diabetic. Where is the eye doctor? And so we're getting a lot more of it. That's obviously in people who have insurance or are insured by the government. In people who don't have insurance, it's much trickier because they're much less likely to see a primary medical provider in the first place, and it gets harder and harder from there on. But I understand the costs of seeing a medical provider are high, but a little bit of prevention can save a lot of money over time. So even for those people who are uninsured and feeling okay, it's still worthwhile to get checked up once a year or once every 2 years by a medical doctor. And that can save a lot of disease down the road. But I would say that nowadays the probability that as soon as you were put on medicine for diabetes, you would be sent to an eye doctor is much higher. And when I say an eye doctor, you need to see somebody who's actually going to do an examination of your eye, not just a test for glasses.
And be fair, back when this started with my eyes, the first place I went to was an eye clinic, and fortunately, that doctor referred me to you right off the bat. He's like, "Don't even go home,"
Right.
So that was, the fortunate thing. And like you said, that was 20 something years ago. So it's good to hear that there's new things that are occurring. So the other, when we first started my treatment, you were looking at several things. So number one, you used some devices. I know in your office today you have two cameras that every time I see you, one's the big camera, the Nikon, and then there's another little one. What are those devices doing?
The two cameras you're talking about are just a simple fundus photo, fundus camera, and that just takes a picture of the back of your eye. That is very helpful because for many years we would look at your eye and make drawings, but obviously comparing drawings over time is not nearly as valuable as comparing photos, so that it's very helpful to look at a photo and say, okay, there are a couple of little dots of blood in the retina, there's a little area of leakage, and let me see what it looked like last year. Has it changed? So those photos are very helpful. The second machine is an OCT, which stands for optical coherence tomography. And it is basically a scan through the center part of your retina, which measures the thickness, which is very helpful to detect and monitor and follow swelling or diabetic macular edema, and also shows us whether there's fluid within the retina. Again, a measure of diabetic macular edema.
When I was doing some reading, the fluid is what's really causing some of the issues. Is that correct? Or not enough, or too much flow to the retina? Is that right?
If you can imagine a part of your body not getting enough circulation for whatever reason, you tie a tourniquet around it or something. One of the first things that happens is that the blood vessels that are there are affected by growth factors sent out, and they leak. So it's not really bleeding because it's not red blood. It's the fluid part of the blood, the liquid, kind of seeping out of the blood vessels. And it seeps out of the blood vessels into the tissues, in this case the retina, and causes it to swell. And that's very common. Those same growth factors occur or are sent out in a lot of types of injury. So for example, if you bang your knee and it gets swollen up, it's the same fluid caused by the same growth factors, but why those growth factors are sent out is different. And if it's, for example, the result of a trauma, well, the trauma is an isolated event, and those growth factors go away, and when they go away, the leakage stops, and eventually the fluid is absorbed and the swelling goes away. In the case of diabetic retinopathy, the lack of circulation is what causes the growth factors to be sent out, and when that circulation does not improve, or if that circulation does not improve, those growth factors continue to be sent out, and so the blood vessels remain leaky, fluid continues to leak out, and the swelling persists, which causes decreased vision. I don't know if I answered your question.
You did. And I'm just trying to analyze all of that and put it into what I experienced. So with the swelling and stuff like that, when you measure for pressure and stuff like that, that has nothing to do with that swelling, right?
That is correct. It does not.
During the beginning treatments, we went through some things like steroid shots and membrane scraping and stuff. Is the purpose of stuff like that?
Part of the result of those growth factors being sent out, those growth factors are inflammatory modulators. They cause inflammation. Just like if you bang your knee and it gets swollen, it's inflamed. Well, if your circulation is not good, the tissue gets inflamed. And so one of the original early treatments for that is anti-inflammatories, like steroids. They can cut the inflammation. They don't cure the underlying problem, which is lack of circulation, but they get rid of some of this inflammation and swelling caused by that. And that can stabilize or improve things. Those are less common now because we now have medications that act directly against the growth factors. So they nip it in the bud a little earlier than an anti-inflammatory. When there is persistent inflammation, you can develop scar tissue. And also, if eventually those growth factors can cause abnormal new blood vessels to grow. And both of those cause membranes, which are the scar tissue and membranes are sort of synonymous. There's actual tissue that grows there from the chronic inflammation, and surgically we can remove those membranes, and that can prevent it from getting worse or sometimes improve it.
Great. Well, now we've covered the how. When we come back, we're going to talk about the O for the options and also what to do next. Please stick with us, and we'll be right back. You're listening to InSight to the Eye from the Wisdom for the Blind studios in Fort Lauderdale, Florida. We'll be right back. Hey, everybody, this is Ben coming to you from the Wisdom for the Blind studios in sunny Fort Lauderdale, Florida. Just want to remind you that we got a great podcast called InSight to Travel, where we share all the latest information on cruises, hotels, restaurants, and everything all over, making your trips a lot easier. Please drop in and listen to our podcast. You can find them on Spotify, Apple's podcast, or any of the other areas that you find. So please remember, share the wisdom, tell a friend. Help Wisdom for the Blind navigate the seas for calmer waters. Hope to see you. Thanks.
Hello, listeners. My name is Ellie here at the Wisdom for the Blind Studios, and I have a PSA. Wisdom for the Blind is now on LinkedIn. We can be found at Wisdom for You. Be sure to follow us on LinkedIn to keep with us. Don't forget to share the wisdom.
You're listening to W4TB Radio from the Wisdom for the Blind Studios in Fort Lauderdale, Florida, where we share some wisdom to help you navigate the seas to stay in calm waters. Please visit us on the web at w4tb.org or drop us an email at feedback@w4tb.org. You can also download the W4TB radio app at the Apple Store or Google Play. Please share the knowledge and tell a friend. Now, back to the show.
Ladies and gentlemen, thanks for returning. We appreciate the studio keeping us up to date. So today we're talking about eye diseases, and we're here with the doctor, and we're going to now get into the options. So, doctor, you've covered what the disease is. You've covered what happens. Now, how about talking about some of the options, and is it curable, or what should we do next?
Well, unfortunately, like diabetes, it is generally not curable. It's manageable. And like with everything in diabetes, our goals are to try to improve it if possible, or at the very least, prevent it from getting worse. By far, the most important aspect of that is keeping the sugar under control. And
what's a good sugar number and a good A1C?
A good A1C, we really, for the eye, prefer to see an A1C below 7.
I'm almost there.
Almost.
Right. Used to be 12, but I'm at 8 now. So I think we've come a long way.
That's a lot better. So that's sort of critical. And a lot of the improvements we're seeing in diabetic eye care are the result of improvements in diabetes care. With, some of the notable improvements lately are obviously better medications. For some people, continuous glucose monitoring, because it's often easier to manage the diabetes if you know at any given moment what your sugar is, rather than a particular time of day when you're doing a finger stick.
I have to agree with that. I do now wear the Libra 2, and my diabetes, like I said, has gone from an A1C of 12. It's down to 8. I still got to go down more. Mm-hmm. But being able to look at my phone and see where I'm at. And like when I go visit you, I know one of the first things you say, "Hey, Ben, how we're doing today?" I can tell you right off the bat, And what I'm seeing now is I'm waking up in the hundreds, 98, 100, 101. And that didn't occur before. So it does help you focus on what your levels are and react. And I can also tell when I eat crap, McDonald's and stuff like that, I can tell the difference.
Yes, it's absolutely a game changer, because you have no choice but to notice that, wow, I just ate something and my sugar went way up. And the last time I ate it, the same thing happened. And it makes you think, well, I need to not eat as much of that. And other things, you can find, well, this is sort of sweet. Maybe I shouldn't eat it. But, in the case of some berries or some other stuff, well, I ate it and my sugar stayed okay. That may be an okay food for me. And it really is very helpful for sort of customizing your habits and diet for you specifically, not at the level of, well, in general, avoid sweet things, and in general, avoid starchy things. It really gets it very specific. And enables you to sort of nip things in the bud. If you see that your sugar is going up, even taking a walk or doing a little bit of exercise can reverse that right at the moment. So I think for my patients, it has made a huge, huge difference. And of course, also there are much better, there's just generally more understanding, and there are better medications to help manage it. And there's a bigger choice of medications, so that, often people are put on medications that they don't tolerate perfectly and sort of dread taking because of various side effects. And even if another medication is not necessarily quote unquote better, it might be better for that particular individual because it causes less side effects. So the first step is that thankfully diabetes management has improved. Secondly, awareness in the medical community and in the eye community of how important it is to address diabetic retinopathy before the vision deteriorates, rather than waiting until the vision has deteriorated and trying to play catch up. That has helped a lot. And so the main thing from a patient's perspective on how is, even if you're perfectly healthy, you should see a primary medical doctor periodically. If you're found to have diabetes, you need to see an eye doctor right away, and stay on top of it, because it, as you noted, unfortunately, it can change relatively quickly. When we catch diabetic retinopathy early, often the first signs that we see are perfectly good vision and no symptoms, but a couple of hemorrhages in the retina where there are areas of damaged blood vessels. And that's sort of a warning sign to say, something's happening, we need to stay on top of it. And it's often a warning sign to the patient to say, whatever your sugar is at now, it needs to be better.
So to, not guess what I did wrong, because we all understand, I had some situations exposed to toxins and stuff in the military, but, neither here or there. But if I would have come to you early before the damage was done, then there could have been a plan to protect the eye.
Correct.
True?
Yes, absolutely. Often, initially, we may not do anything but document where the patient is at. And the photographs and scans we talked about can help with that. And then check again. And that's very useful to see, is it progressing or not? If it is progressing, then we will often do further testing, including what's called a fluorescein angiogram, where we inject an orange dye called fluorescein, which is not radioactive or iodine-based or anything, it's just a colorant, into a blood vessel in the hand or arm, and that circulates, and we take pictures of the back of the eye, and we can directly see which parts of the retina are getting enough blood and which parts are not. That's very important, because if there's a lot of the retina that is not getting enough blood, the vision can still be pretty good as long as the center part is getting enough blood. But that does tell us that if we don't do anything, things will deteriorate. And when I say do anything, the two primary options are medications which block the growth factor, and those are relatively new. They are injected into the eye, which patients find very alarming until they actually have the procedure and realize that we numb the eye well and it's not nearly as bad as it sounds. Or in many cases, just laser treatment, which basically we treat the parts of the retina that are not getting enough blood with laser so that those parts stop sending out growth factors and it doesn't progress. And the stage at which we really, obviously we're always happy to see no retinopathy, but the critical stage is when everything's still perfect from the patient's standpoint, but exam or angiography show that something's brewing, and therefore we can nip it in the bud and stop it from getting worse before the patient even notices visually that there's a problem.
And for those people that have never had the shot, doctors correct, it is a little freaky when somebody comes right at your eye with a needle, but it's not that bad. Just, it's helping you. So, don't get too freaked out about that. But once you start that treatment, then it's ongoing, just follow-ups and make sure that you're working on your sugar, your diabetes, and just continue to talk to your internist and also the specialist. Is that correct?
Yes, it's a battle fought on many fronts, but generally speaking, as if the sugar is not under control, then it is very difficult to keep the eye from deteriorating, even with every treatment possible. It's really an issue of doing both at the same time. And in some cases, it often takes a long time to get the sugar under control, and people get sort of disappointed or frustrated with that. But in some instances, it's really an issue of us keeping the eye from deteriorating until the patient has time to get their sugar under control, and until the sugar being under control starts to show benefits. And that can be a period of months or even years. But the two have to go hand in hand, taking care of the eye, but also bringing the sugar down.
It's all tied back into monitoring your sugar levels and keeping that diabetes under control.
Absolutely.
So in the future, you read things all the time about stem cell research. And do you see anything in your crystal ball there, doctor, that is going to be a breakthrough to help somebody that has the disease or preventing it in the future?
I think there are likely to be many breakthroughs. A lot of, probably amongst the most promising are stem cells, less so for the eye, but rather for the pancreas and for the body to prevent the diabetes or to manage the diabetes without necessary medications from the outside, meaning exogenous medications like pills or injections. So there's a lot of research being done on the underlying problem, which is the diabetes. In the eye, stem cell research at this point is very actively being pursued. It's a tremendous area of progress and research, but there's nothing really on the immediate horizon for diabetic retinopathy in terms of stem cells. Other technologies, we have better lasers than we had before, and they continue to improve. And also these drugs that block the growth factors are constantly evolving and getting better and better, meaning they last longer and longer and require fewer injections. Finally, there is a sort of avenue of stem cell research that's particularly exciting in the eye, where there are modified cells that have been genetically engineered to produce drugs. And those can be injected or surgically inserted into the eye, and they act like a little miniature drug factory, producing over a long, long period of time medications that can stabilize the retinopathy. So instead of injecting them, we inject like a miniature factory. And that also has some very significant promise for the management of a totally unrelated condition called glaucoma, which has a lot of people taking eye drops. So all of those are very exciting. We are also looking at the stage that we intervene at now is blocking the growth factors. But what is really on the forefront of diabetic management, not just in the eye, but in the body, are trying to decouple or unlink the sugar being high from the damage to the blood vessels. Because we take for granted that if your sugar is high, it will damage your blood vessels. But the question becomes how and why. And so if we can intervene in a way that gets people whose sugar is not necessarily perfect, so that elevated sugar causes less damage, that's another area that has clinical trials enrolling now.
How far away do you think that is? Is that 1 year, 5 years?
based on where the clinical trials are, it's probably 3 to 5 years if it works. They're still relatively early.
And after, so the biggest thing is to maintain good sugar levels, like we talked about, a good A1C.
Yes.
How often should somebody come see their internist or their normal eye doctor when they're into a normal routine? Like, for example, you and I see each other every 6 months. Is that a good practice once it's under control?
Yes, once it's under good control. It's really very, very variable. It all depends on how the sugar is controlled and how rapidly the disease is changing. The real critical step, because everyone's eye doctor will be able to tell them, look, things look pretty mild. I'll see you in a year, or I'll see you in 6 months, or things are changing. Let's keep closer tabs on this. The critical one is that getting into the system in the first place.
And that's where it all begins.
That's where it all begins.
And so right now, would it be fair to say that I'm like in a maintenance mode right now? So we're just checking to make sure no damage occurs?
Correct.
And during your review to my eyes, every once in a while, I know we've done like a laser treatment or something like that. That's just to prevent one of the cells from evolving. Is that correct?
Correct. We watch closely to see if there are new areas where the circulation's not good, or there are new areas where abnormal blood vessels are growing. And if we catch them before they've caused a problem, we can often get them to go away before they cause a problem. And that's where sometimes injections or lasers come in that sort of maintenance mode.
In the maintenance mode. Well, we've covered a lot. We're going to take a quick break with the studio, and then when we come back, we're going to wrap it up. But I appreciate all your great knowledge that we're sharing with our guest. So everybody, please stick with us as we wrap things up. This is Insight to the Eye, and we're from Fort Lauderdale's Wisdom for the Blind Studios. We'll be right back.
Looking for a fitness app that is accessible for the blind? Well, look no further. Revision Fitness is just what the trainer ordered. This audio and text-based fitness program has a wide selection of fitness options, including cardio, strength, yoga, balance, flexibility, and even progressive relaxation sessions. Download Revision Fitness on the App Store or Google Play, or visit revisionfitnessapp.com and get a free 14-day trial for new users. Find your fit with Revision Fitness. And as always,
Revision Fitness.
Let's change the way we look at it.
Veterans deserve as much help as they can get. They put their lives on the line for their country, and yet there's still an ongoing mental health crisis among military veterans that needs to be addressed. Well, if you're a veteran who wants the support of fellow veterans and to support fellow veterans, join Wisdom for the Blind's Cup of Joe virtual coffee and chat. It's low-key, fun, and gives veterans an outlet to talk with others who fully understand what they're going through. Get connected at Wisdom for the Blind's website, w4tb.org/cupofjoe.
You're listening to W4TB Radio from the Wisdom for the Blind Studios in Fort Lauderdale, Florida, where we share some wisdom to help you navigate the seas to stay in calm waters. Please visit us on the web at w4tb.org or drop us an email at feedback@w4tb.org. You can also download the W4TB radio app at the Apple Store or Google Play. Please share the knowledge and tell a friend. Now, back to the show.
Ladies and gentlemen, thank you very much for sticking with us. We're here finishing up a great show. Doctor, you've provided a lot of great information, and I really appreciate it. And I appreciate you because you've kept my eyes stable for a long time. In wrapping up, did we miss anything? I also want to talk a little bit about some things I read all the time about new injections coming along or eye vitamins. You got to take this vitamin for that and stuff like that. Any input on any of that, or anything that we didn't really talk about?
Sure. I think one of the most challenging aspects of managing diabetic retinopathy is that it's not really an incident, but it's kind of a condition that requires really lifelong care and continuous progression. And there's a big disconnect with, and I'm sure you'll agree with this, there's a big disconnect between the way it presents and the way it resolves. That is, people generally are pretty well fine. Feeling okay, seeing okay. In the meantime, the diabetes and the diabetic retinopathy is damaging their eye, but it's not necessarily noticeable. And that can go on for years. But from the patient's perspective, the trouble starts fast and deteriorates kind of rapidly, which makes you feel like, well, once I start treatment, the treatment should undo this damage rapidly. And unfortunately, that's not the case. The disease has been gradually eating away at the circulation to the back of the eye for years, and it just manifests suddenly. Unfortunately, in terms of reversing it or stopping it, that's a slower process, and it can be very frustrating. A lot of patients have the experience that, well, my sugar was horrible, but I felt okay and I saw okay. And then I got diagnosed with this, and I got my sugar under control, so things should be okay, but they're not. And that gets people to give up. And that's not what should happen. It's a fight that needs to go on for a long time, because without that, it can almost always continue to get worse. So it is a difficult in that disease, in that sense, and that's why the earlier you catch it, the better. But even if it's caught later than we'd like, stick with it is very important.
I agree tremendously. I've had this disease in my eyes for over 25 years, dealing with it ongoing. And, we, every once in a while, we have to do a little extra laser because, something's here or there. But if we don't monitor it and we don't keep it on track, and I don't keep my sugar under control, then all kinds of things are going to happen. My eyes are going to get worse. I'm very fortunate to have had a kidney transplant. And if I don't keep the sugar under control, then I'm going to lose that kidney. So keeping your body in check goes all the way around. Not only your diet, but your diabetes, your eyes, your kidneys. You have to monitor all of that. And you do have to remember the damage is there. And now you have to learn what to do with it. And there's life after blindness, but you have to react to it. You have to keep it going and keep up on the knowledge and make sure you see your doctor. I agree 100% with that.
And there is a perception that there is sight and blindness, but it's not binary. More vision is almost always better. So even if people meet the criteria for legal blindness or have very poor vision, every little bit helps and is important. So for those people who are most severely affected, usually not with diabetic retinopathy, but with other things, even being able to not see anything except where the light is coming from, that sounds like nothing, but it's not nothing, because it tells you where you are in a room, which way are the windows. And, generally we think of, well, if you're not 20/20, you can't, or correctable to 20/20, you can't see, and et cetera. No. There are the different degrees of visual loss make a difference in quality of life. And as retina specialists, we fight for every last ounce because it makes a difference. So regardless of where you are on the spectrum, it's still worth preserving what you have or trying to improve it.
I tremendously agree. I've worked with some veterans and some listeners that have had a little and they've lost everything. And it's just, they're like, I'm so grateful for what I had. And, it's always important to keep what you had and just maintain it the best you can and be grateful and just continue your life. And that's what we're here for, is to share all the knowledge, share the wisdom, new technologies coming, new medicine coming, new procedures. So
absolutely,
I do agree. And I hope that everybody listened and they gained some stuff out of here, out of this session, and look forward to learning more. What do you think we should talk about next time?
I think, as I mentioned before, diabetic retinopathy is the number one cause of blindness in people under 65. In people over 65 in the U.S., it's macular degeneration. And I think that's worth talking about down the road.
Sounds good. Well, we're going to check into the studio real quick, and then when we come back, we're going to wrap it up. So just stay right with us, and we'll be right back.
Thank you, Ben. And to our listeners, thank you for dropping in today to listen to InSight to the Eye with our host Benjamin Keeley and Dr. Anagnoste. NBA superstar Derrick Rose has officially announced his retirement from the NBA after playing for 16 years. Derrick Rose, on Monday, September 23rd, was waived by the Memphis Grizzlies and announced his retirement on Thursday, September 26th via a post on Instagram. Derrick Rose was the number 1 draft pick in the 2008 NBA draft and was drafted by the historical Chicago Bulls organization. He was deemed one of the most exciting, elite, athletic, and high-flying players that the NBA has ever seen. He earned the 2009 Rookie of the Year award, along with 3 straight All-Star selections from 2010 to 2012. He was the youngest NBA player in history to win the MVP award and led the Bulls through many successful NBA seasons. He will be remembered as one of the most exciting, genuine, and legendary point guards to grace the NBA. He will definitely be a future Hall of Famer for the NBA. In our next order of business, as the 2024 presidential election is approaching, Vice President Kamala Harris and former President Donald Trump are in a very tight race with less than 40 days to go until Election Day. Harris currently has a slight lead nationally of Trump, as many battleground states remain toss-ups. Many experts have deemed this race the closest presidential election in decades. In this year's election, every vote matters. 67 million people viewed this year's presidential debate as U.S. citizens understand this is a very important election and will ultimately determine the future of our country. Don't forget to get out and vote. Thank you to our listeners and the Wisdom for the Blind studio. Now back to you, Ben.
Wisdom for the Blind is dedicated to doing everything we can for the blind and sight impaired. If you'd like to bless us with a donation to keep the website, the podcast, the webinars, and the radio station operating, we can't express how grateful we'd be. You can go to the website at w4tb.org. That's w4tb.org and hit the donation button. Or you can mail it to Wisdom for the Blind Incorporated. Attention donations. 1005 Marine Mile Boulevard, Suite 255, Fort Lauderdale, Florida, 33315. Wisdom for the Blind is a not-for-profit 501c3 organization. Remember, it's tax deductible. We thank you from the bottom of our hearts at Wisdom for the Blind.
What's more perfect than exploring other cultures and dipping your toes in turquoise waters? And doing these things with your family and, of course, your brothers and sisters at Wisdom for the Blind. Don't miss Wisdom for the Blind's first Caribbean Forum at Sea aboard the Carnival Celebration, with games including mini golf, a relay race, basketball, and more. There will be learning workshops in technology, the VA, and medical advancements for the blind. The cruise sets sail from Miami on October 27, 2024, and will go through amazing ports like Costa Maya and Cozumel in Mexico, and Mahogany Bay in Roatan, along with 3 spectacular days at sea. Make lasting friends and incredible memories while learning about fabulous cultures and customs. The cruise starts at just $405 per person based on double occupancy, not including taxes and fees. Go online to w4tb.org/forum or email Wisdom for the Blind at forum@w4tb.org. Book now, space is limited, and don't forget to share the wisdom and tell a friend.
You're listening to W4TB Radio from the Wisdom for the Blind studios in Fort Lauderdale, Florida, where we share some wisdom to help you navigate the seas to stay in calm waters. Please visit us on the web at w4tb.org or drop us an email at feedback@w4tb.org. You can also download the W4TB radio app at the Apple Store or Google Play. Please share the knowledge and tell a friend. Now, back to the show.
Ali, thank you very much for sharing that information with us, and you guys always do a great job in the studio. Well, today we've talked about diabetic retinopathy. Did I say that right?
Retinopathy.
You got to keep me, I just can't move that tongue fast enough for that. And hopefully you all got something out of this session. Remember, if you have any comments or anything that you'd like to ask the doctor or I, you can write it to info@w4tb.com. That's info@4tb.org. And, just send your questions or comments. We'd love to hear from you. And if this is something that you enjoyed, please make sure that you share it with a friend so we can pass that wisdom on. Doctor, thank you very much today for your time. Our first episode is now in the can, and we really appreciate everything that you're doing. And on a personal note, thanks for keeping track of my eyes.
It's my pleasure. Thank you.
Ladies and gentlemen, this has been. We'll be back another episode, so please join us again. Thank you very much. Have a good day.
VA's Office of Blind Rehabilitation Services estimates there are approximately 130,000 veterans in the United States who are legally blind, and more than 1 million veterans who have low vision that causes a loss of ability to perform necessary daily activities. In this era of instant communication, where we get overwhelmed with data or facts that are useless to unsighted individuals, wouldn't it be great if we could count on news focused on real problems that impact the daily lives of veterans without sight? Introducing Wisdom for Blinded Veterans, an advanced informational portal designed by blind veterans specifically for blind and vision impaired vets that, like them, are facing challenges every day. Hi, my name is Ben, and I know the frustration. I've struggled in day-to-day tasks for over 20 years since I lost my eyesight. One of my biggest challenges has always been trying to stay up to date with the latest information of my eye disease, local news, and the ever-changing technology. I wanted to be able to have one single site that merged all the data scattered, and that's why we created Wisdom for Blinded Vets. This is a portal that can be accessed via the web, a smartphone app, telephone, email, text messaging, or Amazon's Alexa. It integrates with readers such as JAWS or Apple's VoiceOver and various other tools to give you a seamless experience. This portal will keep us updated on a variety of topics and will share knowledge that can help make our lives easier and more fulfilled. Highlights of the topics covered on the portal include podcasts, events, news, blind rehab and training, information on the BVA and other groups, a list of coordinator and bros list, online groups to interact with fellow vets facing the same challenges, and much more. Give us a try. You will not be disappointed. To learn more about us, visit our website www.w4bv.org. If you're interested in sharing your knowledge, Please consider becoming a contributor by logging into our portal and going to the contributor section for more information. Wisdom for Blinded Veterans, transforming blind veterans' lives.
"96 years old, but the stories that he told were like something from a Hollywood movie."
Hi, this is Mike Byer, retired Army First Sergeant and Executive Director for Operation Song. Do you love a good story and great music? Then head over to the App Store or Google Play and download our Operation Song app. The Operation Song app is filled with patriotic songs and videos containing the stories of our nation's heroes. You can also see more great content on our YouTube page, and don't forget to like us on social media.
A torpedo hit his ship, and to this day still lives with the fact his buddies died, but somehow he survived.
You've been listening to Insight to the Eye, produced by Wisdom for the Blind and VNS Productions, a division of VNS International. Everybody should carry superior knowledge about their eyesight and how to recognize what is happening with their eyes. We hope you've enjoyed our show. Make sure you like, rate, and review, and we'll be back soon. Until then, visit our website at w4tv.org, and don't forget to share the wisdom and tell a friend.